Hi, and welcome to the Joerns training video, which will cover the features of our UltraCare XT bed frame. The UltraCare XT is a healthcare bed with embedded features that creates a safe working environment for both caregivers and residents. It was designed to reduce the number and severity of patient falls and increase resident comfort and dignity. The UltraCare XT bed frame is a 4-section sleep surface, which provides added comfort to residents, and it provides a safe working environment for caregivers. The objective of this video is to look at the many ways the UltraCare XT can be used to provide that comfort level, and to demonstrate how caregivers can position the bed to avoid having their backs do all the work. To move the bed sections, we begin with the ergonomically designed hand pendant that allows us to easily operate the comfort controls of the UltraCare XT bed frame. The soft grip material makes it easier to hold and prevents damage if dropped accidentally. The design allows residents with some loss of hand control to operate the hand pendant easily and independently, providing residents with greater control of their environment. The hand pendant can be attached on either the right or left side of the bed, depending on whether the resident uses their right or left hand. To do this, raise the bed to its highest height of 30 inches. Then unscrew the cap and pull out on the cord. Simply take the hand pendant to the side of the bed that works best for the resident and reattach the cord by placing it in the socket and screwing the cap back in place. Individual functions can be locked out using the staff control. If the caregiver needs to prevent the resident from raising the knee section, then they would simply press the lock button and up arrow for the knees at the same time. An amber light will appear showing what functions have been locked out. To unlock the function, press and hold the lock graphic on the panel and push the function you wish to unlock. The internal electronics are protected from liquid damage by a water-resistant coating that seals the control device. There are 2 different styles of hand pendants: Standard, which has 6 buttons of operation, and the Advanced Care hand pendant. This pendant includes 2 additional buttons at the bottom. We will discuss Advanced Care options later in this video. In addition to the hand pendant, the bed can also be controlled by using the staff control, which is located on the footboard of the bed. Note, the staff control is not on every bed. Throughout this video, we will show examples of using both the hand pendant and staff control. When transferring residents in or out of bed, caregivers should raise the knee section of the bed first. Then, raise the head section of the bed. This will minimize residents from sliding down in the bed. To raise the knee section, press the up arrow on the right side of the hand pendant. Then, raise the head section by pressing the up arrow located on the left side of the hand pendant. An important benefit of placing the bed in this position is that it reduces the amount of strain that is often placed on the caregiver's back when they are helping residents in and out of bed. Adjusting the bed in this way puts the resident in a better position so that they can get out of bed with less assistance from the caregiver. The UltraCare XT is an industry best with a low height of 7 inches. The UltraCare XT bed should be placed at its lowest setting for residents who are at a high risk for rolling out of bed. When providing care to a resident that is in bed, raise the height of the bed to a position that will minimize caregivers from bending and twisting. A bed is at a safe ergonomic height when raised to a height that is generally between the caregiver's waist and their knuckles. When raising the bed to a safe working height, or when lowering the bed, press either the up or down arrow located in the middle of the pendant, or you can raise or lower the bed using the staff control. Located at the foot section of the bed frame is a feature known as Easy Leg Lift. This feature is built into the bed frame and is an ideal solution for providing care to residents with edema of the lower extremities. To do this, first, put the bed in a flat position. Then, raise or lower the bed to a safe working height. A good rule of thumb to follow is to stand next to the bed and then position the bed where the surface is between your waist and knuckles. Once the bed is at the right height, stand at the footboard end of the bed, place one foot about a foot in front of the other, bend both of your knees, and take a hold of the frame with your arm that is closest to the footboard. It is important that you do not twist your body. Then simply pull up on the frame. You will hear clicks as you lift. When you release the frame, the foot section will be locked into place. When it's time to release the Easy Leg Lift, again, place the bed at waist knuckle height, stand at the footboard end of the bed, bend your knees, and lift all the way up on the frame. This will release the lock and foot section so that the frame can be lowered back to a flat bed position. Headboards are not secured to the UltraCare XT frame. Caregivers are able to lift the headboard up and place it under a resident if there is a need to administer CPR. The UltraCare XT comes with either one of two methods for locking the bed. The first is roll in low, which means the bed is always locked unless a caregiver lowers the bed to where the wheels touch the ground. Roll at any height means the bed will roll at any height unless brakes are applied. Brakes are known as UltraLock and can be located at the foot and or head section. With UltraLock, there are 3 places that allow the caregiver to lock or unlock the bed, making locking the bed less strenuous on staff. To lock the bed, place your foot on top of any of the rubberized pads and press down. To unlock the bed, simply place your foot under the rubber foot pedal and lift up. Now, earlier we spoke about advanced care. The features include 3 positioning features: comfort chair, auto transfer, and gravity assist. Comfort chair allows residents to be placed into a recliner-like position, placing them at eye level with guest or the caregiver. When residents can change their position without assistance from their caregiver, the risk of injury to the caregiver is eliminated, and the independence and dignity of the resident are maintained. Comfort chair is also an ideal position for residents who suffer with pain in their lower legs. To put the bed in comfort chair, hold the button on the lower left side of the pendant. This will automatically place the bed into a chair-like position. Another feature of advanced care is auto transfer, which raises or lowers the bed to a safe transfer height. When transferring a resident in or out of bed, simply hold down the auto transfer button, which is located on the lower right side of the pendant. Before transferring residents in or out of bed, caregivers should raise the knee section of the bed first, then raise the head section of the bed. This will minimize residents from sliding down in bed. Gravity assist is another feature that comes with advanced care. This feature can only be operated with a bed that has staff control. Gravity assist helps to reduce the caregiver's risk when moving a resident in bed. The head of the bed can be anywhere between 4 and 12 degrees lower than the foot section, allowing gravity to help when caregivers reposition residents in bed. Caution: this position may not be medically appropriate nor tolerated by some residents. Check with your supervisor before using. When using Gravity Assist, press and hold the button on the staff control that shows the head in a low position. Once the resident has been transferred up in bed, return the bed to a comfortable position for residents. The UltraCare XT creates a true edge-to-edge 500-pound safe working load. This means added stability and security when friends and family come to visit. If a resident would benefit from using assist handles, please bring this to the attention of your supervisor. An assessment must be provided and documented in care plan in order to utilize this device. Many residents require some assistance to move in bed or to get out of bed. The assistance required can vary greatly depending on the resident's capabilities and condition. Assist devices mounted onto bed frames can provide a secure handle to grasp for residents to reposition themselves or to push themselves to a standing position. The Joerns Deluxe Assist handle features an entanglement-free design that, based on ergonomic principles, provides proper positioning for residents. With the assist handle, residents can safely and comfortably assist in getting in and out of bed. In addition, the Deluxe Assist handle has an integrated pendant holder on both sides of the device. This allows you and the resident to stow and remove the pendant easily. When moving the assist handle, simply pull out the knob and rotate the handle from one position to the other. Using your hand, push hard on the bottom portion of the handle in order to securely lock it in place. Some takeaways from this video. You can reduce the number of times and the degree that you bend over while providing care by using the hand pendant. You can also reduce the force that you use to move residents in bed by recommending a Deluxe Assist handle. Ask your supervisor if the Gravity Assist feature is appropriate or if the Auto Transfer feature is appropriate. Also, you can increase your residents' comfort by placing them in comfort chair and/or adjusting the head and foot section of the bed. Please utilize and store the hand pendant carefully. Well, that concludes our featured training for the UltraCare XT bed frame.